Hey everyone, it's Craig with One Man's Cancer Journey. So as you know, every 6 weeks I get an eye exam and I get a CT scan. Most of us have had eye exams, so you probably know what that's like, but I don't know how many have had a CT scan. So today was my day to get a CT scan, and I thought I would give you a picture of what a CT scanner looks like. It just looks like a big donut, and I lay on a table. You can kind of see the end of the table there. They raise me up and they put me through there, and they take a picture from my abdomen to my neck basically, and go through once, and then they inject a dye into me, and that dye is absorbed by the cancer cells, and then I'll go through a second dye. The dye actually tingles. I can feel it as it's going. It feels like it's going down my throat, but it's actually in my blood. But it's a really interesting experience. Only takes 10 to 15 minutes. Today my tech was Casey. She's the same one I had last time, and she's great. And she tells me that Advent Health also takes care of their employees. So not only are they good at taking care of their patients, but they take care of their employees as well. But anyways, wanted to give you an update of kind of what a CT scan is like. Hope you enjoy it. Hey everyone, it's now Thursday, and I had a full day of chemo yesterday. And so I wanted to give you an update. 6 more weeks, another CT scan. So where are we? As a reminder, remember that we're looking for 3 things. No growth, no new growth, no spreading of the cancer tumor, and hopefully we see shrinkage of the cancer tumor. So our results yesterday, we learned that we're pretty much status quo where we were last time. Again, no new growth, no spreading of the cancer, but we really haven't seen any shrinkage of the cancer. So on the surface, it may seem disappointing a little bit that we didn't see shrinkage, but there is still really good news that the treatments that we're doing is preventing it from growing, and it's preventing it from spreading. And so that's two of the major things that we want to see in addition to the shrinkage. So we're gonna take that as good news. We're gonna continue on. We do have a little bit change in our treatment plan in terms of, as I mentioned earlier, we're going to do a PET scan next. That PET scan's a little bit deeper dive into the tumor tissue to see if it's dormant or maybe dead, and where the cancer cells are still active in that tissue. And so our hope is that when we do this PET scan, which is we haven't scheduled yet, but hopefully it'll be sometime in the month of April, is that we see that there are fewer active cancer cells than in the whole mass. And that would tell us that we're still moving in the right direction. We're just not seeing the shrinkage, but if it goes dormant, that's good, right? That means I can continue to live, and that we're controlling the cancer. Dr. Tajani was on vacation this week, but bless his heart, he still sent me an email to make sure that I had gotten the results in the portal, which I did, and also to confirm that he thought that this was still good news for us. And so I thank him for stepping out during his vacation to not only just look at my results, but then reach out to me. So in his absence, we had Dr. Zakari, one of his colleagues, speak with us, and I'm pleased to share that just another great caregiver in the Advent Health system. He came in, he answered our questions, did a physical evaluation, educated us a bit more about some of the drugs or some of the results that we're seeing in terms of functionality within things in my body, like the kidneys and stuff like that. And so all looks good, but thankful that he was able to step in and provide that insight and for the care that he provided. And Fadl was able to secure our visa or clinical card that they are loading up, and so that's loaded up with past visits, and so that'll give us a little extra money. Just help it's meant to offset kind of travel costs and wear and tear on your car as you come in for the visits as part of the clinical study. After that visit, we went to the 4th floor, which is a little bit quieter than the 8th floor of the top floor, and we had our regular chemotherapy with our nurse Brittany. She was fabulous. She was really on top of loading up the next, making sure we got the next drug from pharmacy in time and getting it loading up. So I think it was the shortest amount of time that we spent in the infusion center to date, but really grateful for the work that she did and the care that she gave to us while we were at the infusion center. So for my gratitude moment, I have to give a shout out to, once again, to the Advent Care team, particularly for this week. It started the beginning of the week with Casey, who this was the second time that I had Casey as my technician for my CT scan. And when I asked if I could do a little video there, she was more than gracious, and it led to a nice kind of personal conversation with her for a little bit after I had my testing done. So it was just nice to connect and have that conversation with Casey, and for her to allow me to video in the treatment room so that you could see what a CT scanner looks like and talk a little bit through what I do. The care continued with Dr. Johnny reaching out to me while he was on vacation to share the test results, which is just, it's wonderful that a doctor is willing to do that and cares for his patients so much that he'll review results and send you a note. To Dr. Zakari for standing in for Dr. Tajani and not just calling it in, but actually, answering our questions and doing a physical evaluation and educating us even more. To Fado, who worked hard with the clinical drug manufacturer to get us the clinical card that we were promised as part of our contract as we agreed to participate in this clinical trial. To Brittany, who was our infusion nurse for the day. I continue to be delighted and surprised by the wonderful care team that's taking care of me at Advent Health. It's been a blessing to be surrounded by people that care so much about you, and you're just not a number or a statistic, but you feel cared for and genuinely thought at. When the nurses remember you, when the doctors ask questions and it's not just checking the boxes, and when people like even my eye care doctor, Dr. Auerbach at the Eye Physicians Center in Maitland, Florida. I see him every 6 weeks, and he just does a wonderful job of making sure my eyes are in good shape, but also caring for me as a person, asking how I'm doing, asking how the treatment's going, encouraging me that, everything looks good from your eyes, no impact from the clinical study. So I don't know if he's part of Advent Healthcare or not. I don't think so, but Dr. Auerbach does a wonderful job as my optometrist and part of what I consider part of my care team. So this week again, I'm very thankful for being surrounded by a wonderful care team at Advent Health that cares for me and takes care of me. My name is Craig. I'm with One Man's Cancer Journey, and I wish for you a blessed week.